Hello? Hello? Can you hear me? Can you hear me? Hello? 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 I can, but you can't hear me. Yeah, I can hear. Hold on a minute. Let me join back again. Okay. Yeah, but you people can be putting in the chat. Yeah, you can put your answers in the chat. I think somebody else is calling. Hold on a minute. Let me mute myself. So let's give few more people time to join. Please feel free to share the link to your friends. Let's see if more people will join. It's just going to be a rapid review. Yes, if you know the answer, you can put it in the chat. Okay. Okay, a few more minutes. Let's see if more people will join. Yeah, please, if you are here, just put your name or just your initial in the chat. Then we're going to start. Thank you all for joining. I said it's going to be a rapid review. So just type in something so that when I call the questions, you can put the answers so that I know you are here. Also, feel free to share the link so that your friends can join. So we can start. Yes, you can say yes, you can say no. Are we ready? Yes. Okay. Yes. Okay. So let's um, give an example. You have a patient that came to your clinic and patient said, I fell with my hand outstretched. I fell with my hand outstretched. What type of fracture is that? I fell with my hand outstretched. Anyone have an idea? Welcome. I fell with my hand outstretched, navicular fracture. It's not a yes, it's Cooley's fracture and navicular fracture, but do you know the difference between the Cooley's fracture and navicular fracture? Because they are all about the same, but it's all just the difference in the anatomic position. So how can we differentiate between Cooley's fracture and navicular fracture? And what is another name for Cooley's fracture? Let's be fast. What is another name? Dinner fork. Dinner fork. Thank you. So that means the navicular fracture, it happens at the snuff box. So like I said, it happens somewhere near the thumb. So somewhere here. Okay. So it's close to your thumb, but the Cooley's fracture is close to your radius or your radius. Okay. Distal radius. So that is the difference. So when will you tell this patient to come back for an X-ray? Because we said if you order an X-ray, it's going to not show anything. So when will you tell this patient to return for an X-ray? In 2 weeks, thank you. So what type of splint can you use for this patient? What type of splint can you use for this patient? We call it a thumb spiker splint. Thumb spiker splint, thank you. Thumb spiker splint. So a patient comes with bicep tendon rupture. Bicep tendon rupture. What test do we use for bicep tendon rupture? What test do we use for bicep tendon rupture? What test do we use for bicep tendon rupture? Bicep tendon rupture. We said that the bicep rolls into a giant ball. The bicep rolls into a giant ball. And what test do we use? We call it hook test. Hook test for bicep tendon rupture. So what test do we use for rotator cuff injury? Rotator cuff injury. What test? Rotator cuff injury. Please, can you be putting in your answer in the chat? Put your answer in the chat. What test do we use for rotator cuff? Remember I said for rotator cuff injury, we use a mnemonic, which is your DEA. DEA. So what is DEA? If you follow in the class, what is DEA? That is the test that we use for rotator cuff injury. So that will be drop arm test. D for drop arm test, empty can, and apprehension. DEA, drop arm, empty can, and apprehension. So remember, this is just a rapid review. If you still have to go back to study, please go back to study if you are still missing some of these things. A patient has macrocytic pneumochromic anemia. Macrocytic, remember the mnemonics MAN, M-A-N, M-A-N, macrocytic pneumochromic. So what are the three anemias that is under macrocytic anemia? Macrocytic, pneumochromic anemia. Macrocytic pneumochromic anemia. What are the three anemias you can find under that classification? Please put in your answers. I don't know if the answers are delaying or if you people are not putting in your answers. Folate, so we use the mnemonic FAB, FAB, F-A-B, FAB, F-A-B, folate deficiency, alcohol, and B is your vitamin B deficiency. Vitamin B deficiency. Okay, did we get that? Patient with macrocytic pneumochromic anemia. The mnemonic we used was MAN, M-A-N. So M-A is macrocytic, then N is your pneumochromic. Then the three anemia deficiency in that group is your folate, your alcohol, and your vitamin B12 deficiency, which is your pernicious anemia. If a patient presents with microcytic hypochromic, what type of anemia is under that? Remember the mnemonic mean, M-I-H, microcytic, small, microcytic hypochromic. So what anemia is under that? Please put in your answers. What type of anemia is that? That is your word. Okay. Iron deficiency, thalassemia, anemia of chronic disease. We also have your sideroblastic anemia. Iron deficiency, thalassemia, lead poisoning. Please include lead. Thank you. Lead poisoning. And even your anemia of chronic disease is also there. Remember the mnemonic we use, TAILS. 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 Thalassemia, anemia of chronic disease, iron deficiency, lead poisoning, sideroblastic anemia. What is the screening test that we use for sickle cell? The screening test for sickle cell. What is the screening test for sickle cell? Or what is it called? The screening test. What do we use to screen for sickle cell? The answer is sickle death. Sickle death. So what do we use for the diagnosis of sickle cell, iron deficiency, and thalassemia? Sickle cell, iron deficiency, and thalassemia. What do we use to make a diagnosis, the gold standard diagnosis for these three anemias that I mentioned? Anyone? Put in your answers. Hemoglobin electrophoresis. Hemoglobin electrophoresis. Thank you. A patient presents to your clinic and patient is complaining, I feel like I'm walking on a pebble. I feel like I'm walking on a pebble. And the complaint is at the third and the fourth metatarsal. Between the third and the fourth metatarsal. What condition is that? I feel like I'm walking on a pebble between the third and the fourth metatarsal. Remember, this is just for studying purposes. If you are still missing something, go back, study. Multineuroma, thank you. Multineuroma. So that is multineuroma, MORTON, multineuroma. I feel like I'm walking on a pebble between the third and the fourth metatarsal. So what test do we use? What test do we use? What test do we use for multineuroma? What test do we use for multineuroma? It also starts with M. Remember, MM. MM. It also starts with M. So what test do we use for multineuroma? Mulder test. Mulder test. MU. Yes, Mulder test. That is correct. So what is that Mulder test? They are squeezing between the first and the fifth metatarsal. So squeezing test is also called the squeezing test. So that is it. The patient will complain, I feel like I'm walking on a pebble between the third and the fourth metatarsal. And the test that they use is what we call Mulder test. Mulder test is also called the squeezing test. Okay. What test do we use for scoliosis? A patient presents with scoliosis. What test do we use? What test do we use for scoliosis? What test do we use for scoliosis? Someone What else do we use for scoliosis? Adam's test. Thank you. Adam's test. So when you do the Adam's test, you are looking for any asymmetrical of the spine. You are also looking at any lumbar curvature, and you are inspecting the shoulders and the hip for any asymmetry. Okay. A patient presents with dilated pupils, high fever, muscular rigidity, mental status changes, hyperphalanx, clonus, uncontrollable shivering. So the buzzword here is that patient is taking SSRI. Remember our SSRI, the sertraline, the citalopram, the escitalopram, the Plaxil. So patient is taking this medication and patient is combining it, or patient combined it with MAOI, monoamino oxidase inhibitor. So patient is taking these two medications together, or patient is taking SSRI with TCA, or with MAOIs, or with tramadol, or with triptans. So any of those. So patient is taking this medication and patient start complaining of rigidity, high fever, clonus, hyperplasia. So what do we call this condition? That is serotonin syndrome. Thank you. So that is serotonin syndrome. Okay. So when you combine SSRI, and we know that SSRI, so can you tell me the 6 conditions SSRI is the first line of treatment? Remember, we mentioned 6 conditions. SSRI is the first line of treatment. Can you list them? Disease conditions. Okay. Depression, anxiety, panic attack, not ADHD, please, not ADHD. Depression, generalized anxiety. But remember, if you need something for acute anxiety, they can get benzodiazepine, which they shouldn't use more than 2 weeks because of the risk of addiction. But they can also use Buspa. Those are the anxiolytic. But for generalized anxiety, you can use it. Then depression, panic attack, PTSD, anorexia nervosa. Okay, PT and OCD. So remember that. So another question, if a patient has PTSD, what type of therapy do we give this patient? What type of therapy do we use for patients that have PTSD? EMDR. Okay, EMDR. What is the herbal supplement? The herbal supplement that we use for patients that have insomnia. What do we call it? The herbal treatment for people that have insomnia. Herbal supplement for patients that have insomnia. That is your cover cover. Cover cover. I don't know. I think your answers are delayed. No, cover cover. You can also use melatonin for sleep, but for the herbal supplement that you use, that is your cover cover. So what is the major reason that women do not like to take the atypical antipsychotic? What is the major reason women don't like to take it? The atypical antipsychotic. Weight gain. Remember, at this time, you should be able to know the typical, atypical antipsychotic, the typical one, which is the first generation. You can remember it as HCT, Hadol, chlorpromazine, and tiorizidine. Then you also have the second generation, the atypical, and that is where you have your Zyprexa, Seroquel, Risperdal, and always remember. So, what is the side effects or possible side effect for Risperdal? Possible side effect for Risperdal. That is, you remember, galacturia. Okay. What is the major side effect, or a patient is on SSRI and patient is taking Paxil? So what side effects should you monitor? Patient on SSRI taking Paxil. Erectile dysfunction. So what medication can we give for the erectile dysfunction? Wellbutrin. Wellbutrin. So which patient cannot get Wellbutrin? Which patient did we say you have to avoid Wellbutrin? Anorexia nervosa. Thank you. Anorexia nervosa. Patient is postmenopausal. Postmenopausal patient is bleeding, because there's no reason that a postmenopausal woman should be bleeding. And this patient is bleeding. What do you order? Postmenopausal woman bleeding. What do you suspect? And what do you order? What do we order for this woman? Ultrasound, endometrial cancer. Ultrasound. What are the 3 signs of pregnancy? 3 signs of pregnancy. Remember, it's classified under 3. 3 signs of pregnancy. We have the presumptive. Presumptive is whatever the woman said. So like the woman said, I think I'm pregnant. I have tenderness of breast. So whatever the woman says, that is presumptive. We are not sure. That is what the woman said. Then you have the probable sign, probable that is like maybe she's pregnant or not. And under the probable sign, we have the HAG, H-A-G. Yes, presumptive, probable. So we have the HCG, sorry. So which is the Haga sign, Chadwick sign, and the Godel. So between the Haga sign, Chadwick sign, and Godel sign. So when a patient presents with blue cervix, the blue cervix and the vagina, what sign is that? The blue one from the name. So that is your Chadwick. Yes. So what if the present present with cervical softening? Cervical softening. Remember the mnemonics? L ends with L. L ends with L. So which one is cervical softening? Cervical softening, Godel. So the L in the end of Godel, put it in the end of cervical. So that is cervical. So patient presents with softening of the uterine isthmus. Uterine isthmus. What do we call that one? Uterine isthmus. So that is the Hegar sign. Hegar. Hegar. Okay. If you have any question, please put it in the chat. A patient presents at late third trimester with a sudden vaginal bleeding. Sudden vaginal bleeding that the uterus, it feels so hard, and there's a dark red bleeding. There's a dark red bleeding. What do we call it? So that is your what? Placenta abruptio placenta, abruptio placenta. So remember, sudden vaginal bleeding, the uterus or the abdomen is very hard, very hard. It feels so hard, and the patient is going to have dark red bleeding. So what if patient presents with a painless vaginal bleeding? Painless. The abdomen is soft. What do we call that? That is your placenta previa. Placenta previa. At what week do we give Rogan? Rogan. Rhogam. Rogan. Remember, Rogan is what they give to the woman if the woman is rhesus negative and the baby is rhesus positive, which the baby will always get from the father. So at what age or what week do we give Rogan? 28 weeks, thank you. A patient presents with a velvet thickening, or velvet hyperpigmentation. Velvet hyperpigmentation is usually on the back, like at the back of the neck. Velvet thickening at the back of the neck here. Velvet thickening due to insulin resistance. Due to insulin resistance at the back of the neck, velvet thickening or hyperpigmentation. What do we call that condition? What do we call that condition? That is acanthosis nigricans. Acanthosis nigricans. ACA, that is under skin. ACANTHROS, acanthosis nigricans. NIGRICANS, acanthosis nigricans. Patient present with a puritic erythematous plaque. You can say fine silvery white scale. Fine silvery white scale. And patient present with pitting of the nail, of the fingernail. You can find it in the elbow. You can find, that is psoriasis. Thank you. So what do we call when we find a new psoriatic lesion? Psoriatic lesion, where someone had like a scab. What do we call that? New psoriatic lesion, where a patient has like a scab or injury. Coronal phenomenon. Thank you. Coronal phenomenon. When a patient presents with an area of pinpoint bleeding, when you remove the plaque, what do we call it? Area of pinpoint bleeding. Auspic sign. Auspic sign. AUSPITZ. Auspic sign. Thank you. Patient present with severe itching, and burrows and the interphalangeal area. Patient present with severe itching, burrows at the interphalangeal area, interdigital. What condition? Severe itching. Scabies. What is the treatment for scabies? What is the treatment for scabies? Remember, we're just doing rapid review. If you don't remember, if you miss something, go back and study it. That is permethrin cream. So what do you educate this patient? What will happen to the rest of the family? What do we educate this patient? What will happen to the rest of the family? Treat the whole family. Wash everything, the bedding, in a very hot water. Everyone will be treated. Thank you. Patient present with a bull's eye lesion. Bull's eye lesion. Patient has been hiking in the northern part, and patient was bitten by Budogera budeferi, the tick bite. What do we call it? Lyme disease. Thank you. If this patient is less than 7 years old, what is the treatment? If patient is less than 7 years old, red rash, central clearing, bull's eye lesion. Red rash, central clearing, bull's eye lesion. If they are less than 7 years old, if patient is less than 7 years old, what is the treatment? Amoxicillin, thank you. But if they are greater than 7 years old, then you can give doxycycline. Please remember that. Yes, if they are greater, then it's doxycycline. And remember the mnemonics, because sometimes you may not see amoxicillin. We use the mnemonic CAD, CAD, CAD. C is your cephalosporin. They can use cephalosporin, they can use amoxicillin, and they can use doxycycline. So CAD, CAD, for the treatment of Lyme disease. And if a patient presents with tick bite, patient had been hiking in the southern part, Patient presents with photophobia, myalgia, petechial rash on the arms and the ankles, on the wrist. What condition do we call this one? It's by tick, rickettsia rickettsii. What condition is this and what is the treatment? Rocky Mountain spotted fever, and the treatment is what? Everybody gets doxycycline. Thank you. Patient presents with a soft, round, everyone gets doxycycline. Thank you. Patient presents with a soft, round, what like it looks like it's pasted on or stuck on the skin. What type of skin lesion is that? Is benign? Is asymptomatic? It's like soft. It's round, it's waft, and it looks like it's pasted on the skin or stuck on the skin. What condition is that? Pasted on the skin, seborrheic keratosis. Seborrheic keratosis, thank you. A patient presents with numerous dry, round, pink to red lesion. It's always on the sun exposed area. It's rough, it's scaly, it's always on the soft area, sun exposed area, and it's a precursor to squamous cell carcinoma. What skin lesion is that? It's a precursor to squamous cell carcinoma. It's a precursor to squamous cell carcinoma. What skin lesion is that? Acanthosis, actinic keratosis. Okay. It's actinic keratosis, and is a precursor to squamous cell carcinoma. So what is the treatment? We have different treatments. If it's on a smaller area, what do we use when it's on a smaller area? And what do we use when it's on a larger area? When it's on a smaller area, what do we use? Yes, if it's on a smaller area, we use cryotherapy. But if it's in a larger area, you are going to use a cream, and that cream is called 5-FU cream. 5-FU cream. Patient presents with upper dermis skin lesion. It's upper dermis is with well demarcated border. It's red. It's on the chin. It's on the cheek with a well demarcated border. What condition is that? Well demarcated border. Erysipelas, thank you. So what organism causes erysipelas? What organism causes erysipelas? Is erysipelas. Rosacea is like a mild to moderate acne. It has like a flushing of the face. But erysipelas is a well demarcated border. It's redness. It's erysipelas, you can differentiate it with cellulitis, because cellulitis is more on the deeper dermis, but erysipelas is more superficial. So erysipelas is caused by group A streptococcus. Group A streptococcus. So we have a patient that presents with fever, myalgia, new onset of murmur. Patient is a IV drug user. IV drug user. And patients have what we call Osler nodes, J-way lesions, hemorrhage of the nail bed. What condition is that? Patient presents with Osler nodes, J-way lesion. That is infective endocarditis. Remember the mnemonics? John, John. John. John is a IV drug user. Patient presents with Osler node. And I say that Osler node is when you see it on just in one finger. But J-way lesion is when it's on the palm. Okay, that is where you see your J-way lesion. So when you see all those non-tender red spots on the palms and the soles, that is your J-way lesion. But when it's only on one finger, that is your Osler nodes. Those painful petechias, that is your Osler nodes. What are the side effects of thiazide? Remember, we mentioned side effects of thiazide. So why should we side effects of thiazide, that you have to use it with caution with people that have gout, people that have diabetes, and which people will benefit from thiazide diuretics? So 3 questions. What are the side effects of thiazide diuretics? Because of it, you have to use it with caution with people that have diabetes. So that is hyperglycemia, gout, hyperuricemia. Thiazide can also cause sulfur allergy. Sulfur allergy is good for people that have osteoporosis. Thank you. People that have osteoporosis. One of another benefits of what we are doing tonight is just to help you to think rapidly, fast for the exam, and it helps you to be able to know how much you have retained or how much you know. So that is very good. And I can see the progress that we have made. Okay, remember, if you have any question, you can put it there. A patient presents with vertigo, tinnitus, hearing loss. What condition is that? No, vertigo, tinnitus, that is Meniere's disease. So what do we educate this patient? Meniere's disease. Tell them to reduce salt intake. They need to reduce salt intake. Reduce salt intake. And it can be caused by endolymphatic fluids. What is the treatment for sinusitis? The treatment for sinusitis. What is the treatment for sinusitis? Treatment for sinusitis. And you should be able to explain or describe sinusitis. They have that facial pain, especially when they bend down. When they bend down like this, they have that facial pain. They also have pain when they are chewing. So that is your augmentin, please. Augmentin, not amoxicillin, augmentin. What test do we use for mononucleosis? What test do we use for mononucleosis? What test do we use for mononucleosis? Remember the test? You remember the mnemonic? HEM, H-E-M, H-E-M. So H is your heterophil antibody test, which is also called the monospot. Then E is your Epstein-Barr virus. So when somebody asks you a question on mononucleosis, remember HEM, H-E-M, heterophil antibody test, Epstein-Barr virus, which is the virus that causes it, and monospot, which is the same thing as heterophil antibody test. So another question, people that have mononucleosis, what are the 4 classic signs? 4 classic signs for mononucleosis. 4 classic signs for mononucleosis. That is your fatigue, cough, strep throat or pharyngitis, and posterior cervical lymphadenopathy. Posterior cervical lymphadenopathy. What over-the-counter medication worsens heart failure? What over-the-counter medication worsens heart failure? What over-the-counter medication worsens heart failure? That is your NSAID. What diabetic medication worsens heart failure? What diabetic medication worsens heart failure? Actose. TZDs, actose. A patient presents with mitral regurgitation. Patient presents with mitral regurgitation. Where will this murmur radiate to? Patient with mitral regurgitation, where would the murmur radiate to? Where will it radiate to? Mitral regurgitation. Where will it radiate to? It will radiate to the axilla. Thank you. A patient presents with aortic stenosis. Patient presents with aortic stenosis. Where will it radiate to? To the neck. Thank you. When is the first time a trail is being palpated? When is the first time a trail is being palpated? In the fourth. What sound do we hear in S3 sound? S3 sound. What sound do we hear? What sound do we hear in S3 sound? Remember the S3 sound? That is the Kentucky sound. The S3 sound, that is the early diastole. And we also say that we use the bell, Kentucky sound. So what sound do we hear in S4? S4. And also remember there is a CHF, or which condition do we hear it? That will be CHF, heart failure, for S3. Okay. But for S4, it's Tennessee. And what conditions do we see S4? What conditions do we have S for? That would be your what? Left ventricular hypertrophy, and that would be also atrial gallop. Atrial gallop. Why S3 is ventricular gallop. So remember the two, ventricular gallop and atrial gallop. What is the treatment for isolated systolic hypertension? Isolated systolic hypertension. What is the treatment for isolated systolic hypertension? Hypertension. That is calcium channel blocker. Calcium channel blocker, yes. That is the treatment. Calcium channel blocker. Yeah, calcium channel blocker. What test do we order for stable angina? Stable angina, and you have to remember the 4 types of angina. If you remember it, you can still put it there. Stable angina, any topic that I mentioned, make sure you know something about that topic, because these are all the topics that is covered in the exam. So please always remember either a stress test. So always remember, like for example, angina, remember what is stable angina, unstable angina, the unstable one is an emergency, pre-metal. Okay, what is the treatment for pre-metal angina? It's the same thing, calcium channel blocker. A patient presents with nocturnal pain they have in the night, nocturnal pain, poor pulses, dependent rubor, intermittent claudication, patient presents with intermittent claudication, shiny, hairless. What is the condition called? What is the condition called? PAD, PAD, thank you. And if you order the ABI test, you need to know the normal ABI test, anything from 0.9 to 1, normal ABI test. Please remember that. And what do we educate this patient? Patient with PAD, what do we educate them? Educate them to stop smoking, educate them to exercise, and also you have to know what stage they are. Remember, they have the stage that they are asymptomatic, and they also have a stage that they have a intermittent claudication. Then they have a stage they have a rest pain. Even when they are resting their leg, they're having pain. And the last stage is the gangrene, when they begin to have that ulcer. Please remember that. Patient present with cold brownish discoloration, swelling, and we call it venous insufficiency. So what do you educate this patient that have venous insufficiency? What is the treatment? The one for PAD, you told them to the one for PAD, you told them to stop smoking, exercise. So people that have elevation, thank you. And then you can do support stockings. But remember, for all these conditions, you have to check other conditions. For example, somebody that have a venous insufficiency, if they have heart failure, you should be careful telling them to elevate, or be careful with compression, because you're going to push the fluid back to their heart. So they have to take their diuretics. Mm. So what is pulsus paradoxis? Pulses, paradoxes. Pulses, paradoxes. Pulses, paradoxes. So remember, upon inspiration, the systolic blood pressure drops by 10. Okay. A patient presents with central obesity, moon face, purple striae, hypertension. So what condition are we talking about? Even not finishing the whole thing. Moon face, central obesity. If they have a wound, it's not going to heal fast. The blood sugar is elevated, the blood pressure is elevated. What condition is that? And the cortisol level is also elevated, mostly because of the cortisol, high cortisol level. What condition is that? What condition is that? So that is your Cushing syndrome. Thank you, Cushing syndrome. A patient presents opposite of Cushing syndrome now. Patient will have a low sugar. Patient is craving for salt. Okay. What do we call this condition? Craving for salt, Addison disease. Okay, Addison disease. Patient presents with elevated calcium level and low phosphorus. Calcium level and low phosphorus. What is that condition? The parathyroid is releasing too much from the bones and it's causing it to float around and it's not helping the bones. So what is that? High calcium and low phosphorus. High calcium level. So that is hyperparathyroidism. And what is the treatment for hyperparathyroidism? What is the treatment for hyperparathyroidism? Treatment of hyperparathyroidism? Biphosphonate. It's the same treatment that you use for osteoporosis. It's the same treatment that you use for hyperparathyroidism. Please take note of that. A patient presents with sausage-like mass, and patients have current jelly stool. What condition is this? Sausage-like mass, current jelly stool. Intussusception. And if patient presents with non-bilious vomiting, olive-like mass, projectile vomiting, non-bilious vomiting, olive-like mass, what condition is that? Remember, once you know the buzzword, you should know what they are talking about. That is your pyrolic stenosis. Patient present with descending colon cancer. So I'll be going through using the book, if you have the book, but I'll just be asking random questions from the book. I know some of you have the book, some of you don't have, so just rapid review from the book. What are the hypertensive retinopathies? Hypertensive retinopathies. Remember the hypertensive retinopathies? Let's be fast. I'm not seeing some people's responses. Some people are not putting in their answer, only few of you. Please put in your answer if you're in this live section. Even if you fail it, that is still fine. We are all here to learn. What are the hypertensive retinopathy? Remember the mnemonics that I use? CAR, C-A-R. So what is CAR? C-A-R. Copper wire arterioles, AV nicking, and retinal hemorrhage. Copper wire arterial, AV nicking, and retinal hemorrhage. So what are the diabetic retinopathy? Under diabetic retinopathy, MCR, microaneurysm, cotton-wool spot, retinal hemorrhage. Retinal hemorrhage. When patient present with a missing P wave, patient present with a missing P wave on the EKG strip, patient present with a missing P wave, what condition is that? AFib, thank you. AFib. Patient present with jugular vein distension, jugular vein distension, splenomegaly, anorexia, abdominal pain, nausea. What type of heart failure is this? Patient present with jugular vein distension, that is right-sided heart failure. Thank you. What is another name for right-sided heart failure? Right-sided heart failure. What is another name for right-sided heart failure? Copulmonale. Copulmonale. A patient present with severe, sharp, excruciating abdominal pain. Remember the mnemonics I use, SAPA. SAPA. Severe, sharp, excruciating pain. Proxectal abdominal mass. Proxectal abdominal mass. A patient present with severe, sharp pain, excruciating proxectal abdominal mass. What condition is that? What condition is that? AAA, abdominal aortic aneurysm. Abdominal aortic aneurysm. Please, if you're on this live chat, please put in your answer so that I know you are here. Even if you don't get it correct, we are all here to learn. So what do we see on an X-ray of somebody that have abdominal aortic aneurysm? There's another mnemonic I gave you for patients that have AAA. What do we see on their X-ray? At least you can write one. We see three things in the X-ray, but you can write one. Anyone trying? Remember the mnemonics TOW. TOW, which is your trachea deviation, obturation of the aortic knob, and widening mediastinum. All these things are in your book. I'm getting it from the book. They are all there. Trachea deviation, obturation of the aortic knob, widening mediastinum. A patient presents with a mid-sternal chest pain, pain is radiating to the jaw, to the back, to the left. Pain radiating to the jaw, to the back, to the left. Patient complains of a cool, clammy skin. Cool, clammy skin. What condition is that? Patient complains of cool, clammy skin. Myocardial infarction. Myocardial infarction. Patient presents with pink tinged fruity sputum. Pink, remember I said PP. Pink tinged fruity sputum. What condition is that? They have a sharp pain, worsening with coughing, breathing, but it's a pink tinged fruity sputum. That is your pulmonary embolism. Pulmonary embolism. Pulmonary embolism. What is the treatment for atypical pneumonia? Atypical pneumonia. What is the treatment for atypical pneumonia? That is, you can put the mnemonic for me, MAD-L. MAD-L. MAD-L, macrolide, amoxicillin, doxycycline, and levofloxacin. Macrolide, amoxicillin, doxycycline, levofloxacin. So if patient presents with pneumonia, and this type of pneumonia, patients have dry cough, headache, interstitial infiltrates or diffuse patchy infiltrates. What type of pneumonia is this? Atypical pneumonia. Thank you. Patient is seen for acute rapid onset with severe fever, lobar consolidation, crackles. What is the most common organism for this type of pneumonia? What is the most common organism for this type of pneumonia? Strep pneumo. Thank you. A patient presents with pertussis. Patient presents with pertussis. At what stage is patient highly infectious? At what stage is patient highly infectious? Patients that present with pertussis, at what stage are they highly infectious? Remember, we have 3 stages of pertussis. What stage is that? The first stage. The first stage is called the Katahara phase. The second is your parazimal. So Katahara is the stage that they are highly infectious. Then you have the parazimal. Parazimal is that stage that they have that actual whooping cough. Then they have the convalescent stage, which is the phase that they are beginning to recover. The stage they begin to recover. What is the side effect of rifampicin, medication for TB? What is the side effect? What is the side effect of rifampicin? Red-orange discoloration of body fluid. Red-orange discoloration of body fluid. Then what is the side effect of isoniazid? Another medication for TB, isoniazid. What is the side effect? And what do we give them to prevent it? Isoniazid, that is your peripheral neuropathy, vitamin B6. Thank you. Vitamin B6. So they have peripheral neuropathy. Okay. So you can say, I need vitamin B6 to prevent neuropathy. I need vitamin B6 so to prevent peripheral neuropathy. So what is the side effect of ethambutol? E for E. E for E. They are going to have eye problem. Eye problem. So red-green color. Red-green color. So they are going to have problem with their visual acuity. Problem with their visual acuity. What is the side effect of pyrizidine or pyrizinamide? This one will cause hyperuricemia or gout. Hyperuricemia or gout. What is the treatment for asthma? Asthma treatment, even if it is using the GINA guideline, what did we say is the treatment? What is the treatment? What did we call the medication? Remember, we combined two medications, Symbicort. So Symbicort, which is the combined formoterol and the budesonide. So they combined inhaled corticosteroid and they combine it with the formoterol, which is the beta agonist, okay, which is your long-acting beta agonist. They combine it with the inhaled corticosteroid, and it's going to give them Symbicort. So it depends on the stage. It's either you do PRN Symbicort, low dose Symbicort PRN, low dose Symbicort PRN, low dose Symbicort daily, then medium dose Symbicort daily. So remember, according to GINA, we have those four. Sometimes, but because of primary care or because of what we are doing, just focus on the four: the mild, intermittent, or the step 1, the step 2, the step 3, the step 4: mild, intermittent, mild, persistent, and moderate, severe. But you call it step 1, step 2, step. So it's either you use a low dose Symbicort PRN for the first stage, the second stage, low dose Symbicort PRN, the third stage, low dose Symbicort PRN, then the fourth stage, medium dose Symbicort daily. Then, of course, in fifth stage, you should be referring them and they will add the anti-IgE. So that is your GINA guideline. You need to know the 5 step. I always say use your fingers as a 5 step. Step 1, 2, 3, 4, 5. So your 1 is your low dose, so Symbicort, like I said, PRN. Step 2, low dose Symbicort, PRN. Stage 3, low dose Symbicort daily. Stage 4, medium dose Symbicort daily. Then 5, you are going to refer them for phenotypic assessment, and they are going to add anti-IgE therapy. So remember that is your GINA. Okay, and if this patient continue to have symptom, you are going to add the leukotriene modifier. So what is the example of leukotriene modifiers we mentioned? Example of leukotriene modifiers, that will be your Montelukast. Okay. A patient presents with, we call it a cancer of the plasma cell. Cancer of the plasma cell. What do we see in their urine? Patient presenting with the cancer of the plasma cell. What do we see in their urine? So if you answer Benson-Jones protein, Benson-Jones protein in the urine, that is correct. Benson-Jones protein in the urine. Okay. Patients present with Hodgkin lymphoma. Hodgkin lymphoma. We say that this one has a better prognosis than non-Hodgkin lymphoma. Hodgkin lymphoma have a better prognosis than non-Hodgkin lymphoma. So what do we see? What type of cells do we see in Hodgkin lymphoma that we don't see in non-Hodgkin lymphoma? What type of cell? That is your what? Red Stemberg cells. Red Stemberg cells. Thank you. Red Stemberg cells. What type of nail or what type of nail condition do we see with somebody that have iron deficiency anemia? That nail condition for somebody that have iron deficiency anemia, what do we call it? Okay, that is your clonacea. Clonacea. Okay, we are going to stop here. It's already an hour, 25 minutes. This is supposed to just be a rapid review. So please, 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 if you can subscribe to my YouTube channel, because I will be using here for live sections. It can be just 1 hour anytime. If I put it there, if you're available, you can join. If you're not available, that is fine. But thank you everyone that joined. So please, if you subscribe, just click the subscribe button so that anytime that I go live, you can always, it will give you a notification so that you can join. So please, I'll be using here. Thank you for the thumbs up, whoever put the thumbs up, but just know that I'll be using here for rapid. I didn't finish, we can't finish. I just want to make it brief. It's not a regular review. Our review is 3 hours, 2 times a week, sorry, Mondays and Wednesday. But then just click on the subscribe button so that anytime I go live, if you're available to join, because I'm planning to be going live more often now, so that if you're you do this format for the weekly review. Yeah, normally I do this, but the only thing is that sometimes people have not finished studying. That is the only problem, you know. Yeah. But like I said, I'll be doing it more often now. So just 1 hour here and there. If you're available, you can join. If you're not available, it's okay. But it at least it helps you to see where you are and helps you to prepare yourself. So please, even if it's 6 p.m., even if it's 7 p.m., just anytime I'm able to go live, I will put the link as many that as. But if you have this, if you subscribe, it will always give you notification and you'll be able to join. Okay. Thank you, everyone. Yeah. Thank you. I hope we learned something this night or this evening or this afternoon, whatever is your time. So please, you can put yes or no if you learned something today, or if you help it will if we help you to think. Some people it will help you to think, right? Yes. Okay. Yeah. Thank you. And like I said, I'll be doing this. I'm hoping to be doing it more often, just 1 hour here and there, and we'll see where we are. But thank you all. Have a wonderful evening. Thank you for joining. Bye. I believe you can always go and listen to it again. Mhm.